Welcome to Shah Medical Surgical. Today we'll explore a common but often misunderstood male condition, prostatitis, or inflammation of the prostate gland. This condition can cause pain, urinary problems, and affect quality of life if not diagnosed and managed properly. We'll cover everything: types, causes, symptoms, diagnostic tests, treatments, and prevention tips. Let's dive in. What is the prostate? The prostate gland is a small, walnut-sized organ located just below the bladder in men. It wraps around the urethra, the tube that carries urine and semen out of the body. Its main function is to produce a fluid that nourishes and transports sperm. Due to its position, any inflammation in the prostate can lead to urinary and sexual symptoms. Types of prostatitis. There are 4 main types of prostatitis: acute bacterial prostatitis, chronic bacterial prostatitis, chronic prostatitis, chronic pelvic pain syndrome, CPPS, asymptomatic inflammatory prostatitis. Each type has its own set of symptoms, causes, and treatment methods. Prostate location. The prostate lies directly below the bladder and surrounds the upper part of the urethra. Because of this anatomical position, any swelling or infection in the prostate can cause urinary retention or difficulty urinating. The gland is also close to the rectum, which is why a digital rectal exam helps detect abnormalities. It plays a key role in male reproductive health. Acute bacterial prostatitis. Overview. Acute bacterial prostatitis is a sudden and severe infection of the prostate. It is usually caused by bacteria that travel up from the urethra or bladder. It requires urgent medical treatment, especially if the patient has fever or difficulty urinating. This condition mostly affects young or middle-aged men. Acute prostatitis. Symptoms. Common symptoms include high fever and chills, pain in the lower abdomen, pelvis, or perineum, burning sensation while urinating, trouble starting or stopping urine flow. In severe cases, the person may be unable to urinate at all. Acute prostatitis. Causes. The most common causes are spread of a urinary tract infection, UTI, use of an infected urinary catheter, prostate manipulation, such as during a biopsy, weak immune system or chronic health conditions. Early detection and antibiotics can prevent complications. Chronic bacterial prostatitis. Chronic bacterial prostatitis is a long-term infection of the prostate. Symptoms are usually less severe than acute prostatitis but may last over 3 months. Patients often experience flare-ups that come and go. It may follow an untreated or partially treated acute infection. Chronic prostatitis, CPPS. This is the most common type of prostatitis and also the most complex. It is not caused by bacteria and often has no identifiable infection. Symptoms revolve around chronic pelvic pain lasting at least 3 months. It may also include urinary or sexual discomfort, often affecting quality of life. CPPS. Possible triggers. Possible contributing factors include psychological stress or anxiety, pelvic floor muscle tension or spasm, nerve damage or chronic inflammation, history of previous infections. The exact cause is often unclear, making treatment more challenging. Asymptomatic inflammatory prostatitis. This type has no symptoms at all and is usually discovered incidentally during a prostate biopsy. PSA testing. Semen analysis for fertility issues. Although inflammation is seen, no treatment is usually required if the patient has no complaints. Symptom summary. Symptoms can vary by type, but generally include pain in the lower back, pelvis, or perineum, painful or burning urination, urinary urgency or frequency, pain during or after ejaculation, fever in acute cases. Long-standing prostatitis may lead to frustration and psychological stress. Physical examination. A digital rectal exam, DRE, is performed by inserting a gloved finger into the rectum. The doctor feels the size, shape, and tenderness of the prostate. In acute prostatitis, the prostate feels swollen, warm, and very tender. In chronic cases, the gland may feel normal even if symptoms are present. Investigations. Diagnosis may include urine tests for white blood cells or bacteria, urine culture to detect bacterial growth, PSA test, which may be temporarily elevated during inflammation, ultrasound or other imaging if abscess or obstruction is suspected. These help determine the type and guide treatment. Urine flow studies. If the patient complains of weak urine stream or straining, doctors may perform uroflowmetry. This measures how quickly urine flows and whether the bladder empties completely, helpful in chronic prostatitis and to rule out other conditions like BPH. Semen analysis. In men with chronic prostatitis or infertility, semen analysis may reveal increased white blood cells, decreased sperm motility, presence of bacteria. This helps assess inflammation and sperm quality. Treatment: acute bacterial prostatitis. Treatment includes intravenous antibiotics if the infection is severe, oral antibiotics like Ciprofloxacin or levofloxacin, painkillers such as ibuprofen or paracetamol, plenty of fluids and rest. Hospitalization may be needed in serious cases. Treatment usually lasts 2 to 4 weeks. Treatment: chronic bacterial prostatitis. Chronic cases need long-term antibiotics, often 4 to 6 weeks. Additional measures include alpha blockers to relax muscles and improve urination, anti-inflammatory drugs for pain, sitz baths for pelvic comfort, reducing caffeine, alcohol, and spicy food. Relapse is possible, so proper follow-up is essential. CPPS treatment. Chronic pelvic pain syndrome treatment is multidisciplinary, pelvic floor physical therapy. Psychological support if stress or anxiety plays a role. Neuromodulators or pain relievers. Avoiding bladder irritants like tea, coffee, and acidic foods. Treatment may take time but can significantly improve quality of life. Lifestyle tips. Here's what can help prevent or ease prostatitis: drink plenty of water. Avoid alcohol, caffeine, and spicy foods. Don't hold urine for long periods. Avoid sitting for hours, take breaks. Practice safe sex and maintain hygiene, especially with catheters. These habits reduce both occurrence and recurrence. Complications. If untreated, prostatitis may lead to prostatic abscess, sepsis, a life-threatening infection, male infertility, chronic pain, urinary retention, requiring catheterization. Early diagnosis and full treatment prevent most of these complications. Prostatitis versus BPH versus prostate cancer. Let's briefly compare prostatitis, inflammation, often with pain and fever. BPH, benign enlargement, usually causes slow urination. Prostate cancer, uncontrolled cell growth, often silent early on. Each has different treatment, so proper evaluation is key. When to see a doctor. Consult your doctor immediately if you have sudden fever with painful urination, pain during ejaculation, blood in urine or semen, inability to urinate, chronic pelvic or back pain. Never ignore these symptoms. Early help leads to better recovery. Prostatitis is treatable, and with the right approach, most men recover fully. Thanks for watching. If you found this video helpful, please like, share, and subscribe to our channel for more trusted medical information. Stay informed, stay healthy, and we'll see you in the next video.